Today I will be interviewing John Jarrell of Laurel Healthcare about a part of the healthcare system that is seldom talked about, nursing homes. Many people never want to have to consider nursing homes, but they are in fact an extremely important part of the healthcare system today. So as an administrator for Laurel Healthcare, what is your role in the building?
I am Chief Financial Officer. I'm the Chief Executive Officer of approximately 140 employees and a 140 bed facility, very large facility. I oversee policies and procedures, implementation of policies and procedures, hiring, terminating, making sure that we're in complete compliance with the federal regulations for long-term care. I'm a liaison with the community. I meet with chambers and hospital CEOs, discharge planners. I make sure that we have a seamless entry into our facility from hospitals to make it easy for hospitals to discharge their patients to us and to get those patients moved back either home or to more appropriate settings, things like that.
So with such a large building, what is your approach to providing the best care for all of your residents?
I think I try to hire the most knowledgeable and best manager for each department. Over 9 years, I've put my own team of managers into the facility where, for instance, dietary manager, I have a chef that is a dietary manager, and he also knows about long-term care regulations. He makes sure that we are in compliance at all times with food, and that food is not just like nursing home food, but more palatable, more customer-oriented. The director of nurses has a lot of experience being a director of nurses. She's been a person that's worked for a corporation before and has overseen multiple facilities at the same time. But I tend to look for people that have experience, but at the same time, for some positions, I'll hire new employees. For instance, my activity director that just started has come from a program where I can get by with the basic activity director, where it's a 12-hour course in a community college. But this person is a certified therapeutic rec specialist. Comes from a program. It's a bachelor's degree program in Greensboro or in Greenville. The last 3 people I've had in that position has come from that program. So I tend to hire the best person I can for the position, and I'll take new grads in a position like that and build them over a period of time to where they'll go on to where they want to be in their careers as well. So good hiring practices.
So what do you think the role of nursing homes are in helping public health?
In public health, nursing homes play a vital role. Hospitals are now more in an acute setting. They're in for very short periods of time due to constraints from insurances, Medicare, Medicaid, those kind of things. Hospitals need to move people out as quickly as possible. The overhead for hospitals are very high, whereas a nursing home overhead is much less expensive. So you can move people from acute to subacute or less than acute care setting like ours. It helps to get those people rehabbed less expensively, which is less burden on society who's paying for Medicare, Medicaid, and those things, and gets them moved into a more appropriate continuum of care, either back to home, assisted living, independent living, and places like that. At the same time, our role is to take care of folks that aren't able to be taken care of at home anymore. Some of these folks will go to the emergency room, be admitted to the hospital, try to be sent back home. They'll be there for a while and then back to the hospital. Then they might come back to us, that sort of thing. But it's all a continuum of care that we provide.
So I guess would you say that nursing homes serve more for long-term care as hospitals and doctors are more for short-term instances?
We're probably 20 to 30% of our business is short-term care. We do have a significant portion of our facility is long-term care, but we do provide a lot of short-term care as well.
Why are nursing homes such an important facet of the healthcare system?
Again, when there's just so many dollars to go around for providing care for the elderly or injured, things like that, it is a way to get folks taken care of, rehabbed, um, in a good, short period of time, and then back to where they can, get maybe receive still like physical therapy and assisted living, things like that. It's just a part of the continuum of care that all has to do with making sure people are appropriately placed.
Okay. So, even though nursing homes have such a positive effect on the healthcare system, why do many people see it as like a negative going to a nursing home?
You see billboards for neglect, abuse. Lawyers have billboards all over the place. If you look up nursing homes on the internet, you'll see there's all kinds of advocacy groups for safe placement for your loved ones and things like that. There's a lot of publicity, negative publicity, whereas we are the highest regulated industry next to nuclear energy in the country. We have over 500 regulations that we have to abide by and make sure that we're in compliance at all times. We do background checks, we do drug checks, drug tests. We take concerns and complaints daily. People lose an item of clothing, they'll drop $1. We have to check on these things all the time. The public thinks that you come into a nursing home, you'll get a wound, you'll get an infection, whereas our wounds and infections come from the hospital. In the nursing home, you have folks that turn position and things like that. There's a lot of things that we do to prevent issues. We strive. We have a 5-star system that we are portrayed in the community as. We try to reach those 5 stars just because hospitals tend to send their patients to a 5-star facility. You can end up with a 1 or 2-star facility and still be providing really good care. The star rating system that folks look at is still not a really good system. We take high acuity wounds, trachs, left ventricular assist devices, just a lot of high tech things, and we're dinged on those items. So if you look on our website, you'll see maybe a lower, you won't see a 5-star or a 4-star, but we do very well with our surveys and we do well with providing care. But again, the public sees all these ads and billboards that, it's bad going to nursing home. And again, we don't take as good a care as families think that they take care of you. If you stay at home, your family thinks that they've done the best for you. And there's a lot of guilt when you go into a nursing home. When a family has to put a person into a nursing home, there's a lot of guilt associated with it as well. So even though there's some negative connotations, there's a lot of living that goes on in the nursing home. In 140 beds, we have a lot of people that do really well. They sit at the door waiting for me in the morning to tell me hi. They sit at the door waiting to tell me bye in the afternoon. It's like family. So it's really not bad.
Well, thank you so much for coming.
Oh, you're welcome. Thank you for having me.